Hi, I'm Dr. Ron Kurzako, author of The Total Parent. Today's topic is difficult breathing. And some of the things that can cause difficult breathing include things like pneumonia, asthma, bronchiolitis, or even an allergic reaction. Some of the things you need to look for in terms of identifying if your child has trouble breathing, I've actually made it very easy for you by developing a breathing checklist. And if you look at this next illustration, you'll see all the things that you need to assess or check for in your child in order to really evaluate their breathing. It's an acronym in which each of the letters stands for something to check. So let's start with the letter B. B stands for breath sounds. So you're listening to the child's sounds of breathing to see if they sound congested or wheezy or stridorous, which means that they kind of take a breath like that in. That would be a stridorous sound. The R stands for the rate of breathing. And if you look at the checklist, you'll see in the lower left corner where I've identified the rate of breathing for each child's weight or their age. The E stands for eye contact. And eye contact means how are they looking at you when you check them out? Are they having good eye contact? Are they focusing on you? Or are they really fussy and looking away? The A stands for two things. It stands for abdominal breathing and it stands for appearance. Abdominal breathing means that the abdomen is moving in and out quite a bit because the child has trouble breathing. Appearance means the child of the colors lips. Are they pink or are they blue? If the lips are pink, that's a good sign. If it looks like there's a bluish color to the lips, then we need to be concerned that they may not be getting enough oxygen. The next letter T stands for temperature. Temperature means, is there a rectal temp of 100.4 or more, because that means a fever. So you need to check your child's temperature. The H stands for heavy breathing. And again, you look at the child's general sense of their breathing and see if it seems to be heavier than normal. The I stands for inner rib retractions. And inner rib retractions means, what I like to do is I like to look at the child in mom's or dad's arms over the shoulder, and I look at their ribs when they're over mom or dad's arms, and I see if the rib muscle is being pulled in. And you'll see in the illustration here what inner rib retractions look like. So if you see these retractions, that's a good sign that the child is having some trouble breathing. The N stands for nasal flaring, and nasal flaring means that the nostrils are dilating with each breath. So if you look at their nostrils, again, I like to look at the child over mom or dad's arms, and if you see the nostrils dilating, that's a sign of nasal flaring. The G stands for grunting, and grunting is a sound that sounds kind of like this. Grunting occurs when there's a little bit of fluid in the airways of the lungs, and that causes a child to do this grunt. It's kind of like a little bit of a cough. So keep in mind all the things that are included in the breathing checklist. Make sure you understand what inner rib retractions are, you understand what a temperature is, 100.4 rectal or more, and if you keep those things in mind, I think you'll be a better parent. Thank you. My name is Dr. Ron Kurzako.